Podcast 38, Week 40, and Being Overdue. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing, and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at week 40, then we'll discuss what happens if you're overdue. If you're in pain waiting to go to the hospital, you can do some things to help manage discomfort. Get up and move. Walk around. Ask your partner to give you a massage. Hot or cold compresses may help reduce cramping and aches and pains. A warm shower or bath can feel good too. You can also try some breathing exercises. At the beginning of each contraction, take a deep breath. Exhale slowly. At the end of the contraction, again breathe deeply. Ask your doctor at a prenatal visit how you should prepare to go to the hospital. He or she may have some specific instructions for you. When you get to the hospital, you'll be asked many questions. A brief pregnancy history is taken. Vital signs are noted. Tell them about any medical problems you have and any complications you have experienced. A pelvic exam is done, and if you're in labor, you'll be admitted to the hospital. You'll be told about any procedures that may be done and risks involved. You may be asked to sign forms from the hospital, your doctor, and the anesthesiologist acknowledging you received this information. Once you're admitted, you may receive an enema. Blood may be drawn. Your doctor may want to discuss pain relief, or you may have an epidural put in place if you've requested one. If you have decided to have an epidural, or if it looks as if labor will last quite a while, an IV will be started. A monitoring belt may be put in place to record contractions and baby's heartbeat. In some cases, when you go to the hospital, you may learn someone else will deliver your baby. It's not always possible for your doctor to be there for the birth of your baby. This happened to me. When I got to the hospital, I was told my regular doctor had left for vacation, and a doctor I'd never met before was covering for him. His name was Peter Parker, and I was honored to have Spider-Man deliver my son. We discussed pain relief meds in podcast 37. Now's the time you may have to make some decisions about pain relief, especially if you don't want to use medication. To be honest, I never considered natural childbirth. After hearing my friends' stories of what they went through during labor and delivery, I knew long before my due date I wanted an epidural. So as soon as I got into labor and delivery, I asked for one. You may not feel that way. Many women don't want any medication during labor. That's their choice. Explore various non-medication pain relief methods you might want to use. Do it well before your due date so you'll be informed when labor begins. There are many non-medication techniques available, such as continuous labor support, water therapy, hypnosis, and acupuncture or acupressure. Other techniques also available include walking, changing positions, or rolling on a birthing ball. Massage has been shown to help reduce pain. One study showed women who were massaged 20 minutes every hour during active labor felt less anxiety and pain. Many parts of the body of a laboring woman can be massaged. Different types of massage affect a woman differently. Well before labor begins, you and your partner may want to practice effleurage, a light, gentle finger tap massage over the abdomen and upper thighs, or counter-pressure massage, which can relieve back labor pain. Ask your doctor for information about both methods. Different laboring positions may allow you and your labor coach to work together to find relief. This can help you feel closer and helps you share the experience. Some couples say using these methods brought them closer and made the birth experience more joyful. Most women in North America and Europe give birth in bed on their backs. Although this is the most common position, it can slow labor, lower your blood pressure, and make baby's heart rate drop. Today, some women want to try different labor positions. Kneeling, squatting, sitting, or standing up all let the abdominal wall relax and the baby descend more rapidly. If you want to use a different laboring position, massage, or a relaxation technique, don't wait until you're in labor to ask about it. Discuss it with your doctor at one of your prenatal visits. Ask about facilities at the hospital you'll use. Some have special equipment such as birthing chairs, squatting bars, or birthing beds. Kneeling on hands and knees can help relieve the pain of back labor. When you can't kneel, lie on your side. Lie on your left side, then turn onto your right side. We know labor is hard work. It's like running a marathon. In the past, women weren't allowed to eat or drink during labor. Many experts now believe food and liquid is necessary to provide a woman energy to do all this hard work. Letting a mom-to-be have some nourishment during labor gives her some energy to keep going. The American College of Obstetricians and Gynecologists has issued guidelines that women in labor don't have to forego all nutrition. If a woman has a normal, uncomplicated labor, she may drink modest amounts of clear liquids. Sports drinks, even a protein shake may be okay. Others believed cooked fruits, toast, eggs, and crackers are also okay to have. Talk to your doctor about it at a prenatal visit. If you're scheduled for a cesarean delivery, you may drink clear liquids up to 2 hours before anesthesia is given. Don't eat solid foods for 6 to 8 hours before surgery. If your labor is long, your body may be hydrated with an IV. After baby's birth, if everything is okay, you may be able to eat and drink without much restriction. Your labor coach may be one of your most valuable assets. He or she can help you prepare, support you as you go through labor, and share the joy of welcoming baby. In most instances, your partner will be your labor coach. However, this isn't an absolute requirement. A close friend or relative, such as your mother or sister, may act as your labor coach, or you may choose a doula. Don't force your partner or labor coach to watch the delivery. It's not unusual for a labor coach to get lightheaded, dizzy, or pass out. On more than one occasion, coaches or partners have nearly fainted just from talking about plans for labor and delivery. Your labor coach can do many things, such as timing your contractions. He or she can comfort you, distract you, or help you relax. A coach can protect your privacy. He or she can support you while you push and do other things too, such as take pictures. Work together to decide what you want to accomplish. It's all right for your labor coach to rest or take a break during labor, especially if it lasts a long time. It can be hard work being a coach. Talk to your doctor about your coach's participation in the delivery, such as cutting the umbilical cord or bathing baby after birth. These things vary from one place to another. Decide ahead of time who needs to be called after baby's birth. Be sure the names and numbers are in your phones, and bring a written list of names and phone numbers with you too. There are some people you may want to call yourself. A telephone may be available in the labor and delivery area, or you may be able to use your cell phone. After delivery, take some time for yourselves with your new baby. When you're ready, then you can introduce baby to friends and relatives and share the joy with them. When you're overdue. Your due date has come and gone. You haven't delivered and you're getting tired of being pregnant. You keep hearing, "I'm sure it'll be soon. Just sit tight. Hang in there. It will soon be over. The wait just seems never ending right now." If you pass your due date, you're not alone. Nearly 10% of all babies are born more than 2 weeks late. A pregnancy is considered overdue only when it exceeds 42 weeks. A baby born at 41 weeks, 6 days is not overdue, even if it feels like it to you. Your doctor can determine if baby is moving okay and the amount of amniotic fluid is healthy and normal. If all seems well, you're usually monitored until labor begins on its own. Tests may be done as reassurance baby is okay and can remain in the womb. If there are signs of fetal stress, labor may be induced. It may be hard to keep a positive attitude when you're overdue, but try. Eat healthfully and keep up your fluid intake. If you can do so without problems, get some mild exercise like walking or swimming. It may help you feel better. Most babies born 2 weeks or more past their due date are delivered safely. However, carrying a baby longer than 42 weeks can cause some problems. When a pregnancy is overdue, baby may begin to suffer some nutritional loss. Different tests may be done to reassure you and your doctor baby is okay and can remain in the womb. One of the first tests is a vaginal exam. It will probably be done every week to see if your cervix has begun to dilate. You may also be asked to record kick counts. A weekly ultrasound may be done to determine how big baby is, how much amniotic fluid is present, and also to identify any problems with the placenta. 3 other tests may be done to check baby's well-being inside the womb. They are the nonstress test, the contraction stress test, and the biophysical profile. These tests help determine whether baby is okay or may need to be delivered. Your doctor will evaluate all the information, then advise you on your next course of action. There may come a point in your pregnancy your doctor decides to induce labor. This means labor is started to deliver your baby. It's a fairly common practice. The Bishop score may be used to predict the success of inducing labor. Scoring evaluates how ready you are to give birth. If labor will be induced, the cervix may be ripened first. Medication is placed in the top of the vagina and is released directly onto the cervix to help soften, thin, and dilate it. This is done in labor and delivery so baby can be monitored. You'll receive oxytocin through an IV, which starts contractions. The length of the entire process, ripening your cervix until the birth of your baby, varies. Being induced doesn't guarantee a vaginal delivery. Sometimes induction doesn't work. Inducing labor may increase your chances of having a cesarean delivery. That's it. We've gone through pregnancy from start to finish. Our companion book, Your Pregnancy Week by Week, contains information detailing the postpartum period. That's the first 6 weeks after baby's birth. You may want to read that information so you'll know what you'll be dealing with along with your new baby. We also cover feeding your baby and postpartum distress syndrome in detail. If you'd like to read a week-by-week book about baby, take a look at our book, Your Baby's First Year, Week by Week. We know how busy you'll be with your new baby. You just may not have much time to devote to reading. Our baby book covers your little one's development and growth in a weekly format, so you don't have to digest too much information all at once. Each week is a fairly quick read. Thanks for listening to this podcast. We want to wish good luck to you as you begin your wonderful new life as a family.